flashes and cool topics. We are continuing with our interviews live at Wise Pause, and we are excited to have Dr. Anju Mathur on the show. Thank you for coming on. You actually just got off the stage. You gave a great speech about brain aging and how we can, women, we hear a lot of women say brain fog, I can't remember anything anymore, I don't understand what's happening. Can you talk a little bit about the causes of brain aging and how we can start to recognize it in women?
Oh, for sure. So brain aging is actually one part of menopause. Menopause affects practically every part of the body. But the brain aging is very obvious because the symptoms are so severe, right? In fact, what I wanted to say was that usually when people look at menopause, they're looking at the end of the reproductive ability of the woman, right? It's the biological clock has run out. But actually, in fact, what's happening is that when a woman enters the perimenopause and menopause, she starts getting the symptoms related to brain aging. You see? So most of the symptoms, actually all of the symptoms, besides the skin laxity going down, but most of the symptoms for which women seek treatment, hot flashes, night sweats, even brain fog, insomnia, irritability, anxiety, panic, they are coming from brain aging related to menopause.
That's fascinating. I don't think, that's like one of those moments you're like, really, I did not know that. So a lot of women will say it's menobrain or, brain fog. Can you explain what it is, what the symptoms are with menobrain?
Yeah. So menobrain, a person starts feeling like, for the most common complaint that I get from my patients is that I don't feel like myself. That I've turned into this alien entity that I don't recognize.
Yes.
They lose their temper, they snap at their children or snap at the husband. The marriage is on the rocks because they can't, be themselves.
Yes.
They've turned themselves into this alien monster. So this is very, very common, and that's really what the menobrain that we are calling menobrain is, the brain aging caused by declining hormones.
Yes. And you were talking about that upstairs, so can you share a little bit about the declining hormones and how they affect us? I know you mentioned estrogen, and can you talk about how that affects women?
For sure. So when the declining hormones include practically a lot of different hormones. However, during menopause, the main symptom that people are experiencing is because of the decline of the estrogen as well as progesterone, right? As well as testosterone. So most of the commonly that's what you see. And the estrogen and the progesterone not only affect, like I said in my talk, on the pituitary and the hypothalamus, but they're actually affecting the other parts, which are regulators of mood, memory, and even sleep and the learning ability. So when you lose that support of the brain and the brain cells, you're losing those faculties. And that's really what's happening. It's not the lack of antidepressant or the anti-anxiety or the sleeping pills that is causing your symptoms. So instead of handling each symptom by one drug, like a Band-Aid medicine, I say that why don't we handle the root cause of the problem and go for the actual cause of it, handle that, so then you don't have to worry about each symptom by itself.
Yes, you said some things up there that I was like, yeah, that happened to me, and I was initially prescribed an antidepressant when I went to a doctor with my menopausal symptoms, and I held off too. And you also brought that up as well because of the report back in 2002 or 2003, the Women's Health Initiative report. So I hesitated to even talk about going on hormone therapy. But you addressed that upstairs as well, but you also addressed some of the other things, the Premarin, that you talked about that. Can you share with our listeners something about that?
Yeah. For sure, yeah. Every time a patient comes, sometimes I get patients who are afraid of the hormones, right? Mm-hmm. They tell me, and I immediately ask them, I say, what are you afraid of? And they say, breast cancer, right? Mm-hmm. Because nobody wants to get breast cancer, right? I don't either.
No. Yeah.
So, so what actually happened when the Women's Health Initiative study came out in 2002, it was promoted widely in the public, saying the hormones cause the breast cancer. but that was incomplete data. It wasn't actually the hormones that caused the breast cancer. I can even go to that extent and say that, because the drugs that were used, the one that you mentioned, Premarin, is actually stands from pregnant mare's urine. Yes, we have been
Okay,
given.
yuck. There you
Yeah,
go. There's
yeah.
just yuck. That's a
It's
thought.
yuck, and also for the horses too. I've heard it's really difficult. Not only that, all the way around.
Yeah,
Which is not a good choice.
Yeah.
Yeah, I don't think so, right? I don't want to be giving horses hormones.
Yes.
I don't know if there's anybody out there. Plus, the fact was the progesterone that they call progesterone is actually synthetic progestin. So that change in the sequence and the chemical structure of the progesterone causes the side effects, because it is not natural to the body. So anything you put in the body that's not natural, the body is going to fight it. And that fighting is what causes the adverse effects, right? So if you go natural, which is bioidentical, now bioidentical is a new word, because there wasn't any word for what I'm going to describe as a bioidentical, because it wasn't in the English language. So the bioidentical was coined maybe 2 decades ago, and that denotes a class of hormones that are actually man-made, right? But they are identical to the human hormones. So when the body gets that, it doesn't say, "Whoa, what is that?" You know,
It's familiar.
It absorbs it, and it's familiar. There's no adverse effects that happen. The only effects that can happen is that you can give too little of something, or you can give too much of it. Because now that we are giving exogenously, right? We don't have our own natural hormones. We're giving ourselves exogenously. So now we have to make sure that the amount and the dose is completely correct for you. And that's where you need the physician who is very familiar and experienced with BHRT for.
For that.
Yeah.
When they are trying to figure out the right amount of medicine, how would that testing go? How would a patient find out what's the right amount for
Is
them?
it trial and error?
Yeah, well, here's what it is. Actually, it's a very interesting question. Actually, a very important question. We have actually education pamphlets that we give to the patients. Yes, it is a trial and error in a way, but on the other hand, it can be very educational, as well as, like, knowledge is power. So I like to give the knowledge to my patients to decide what's right for them. Like one of the doctors mentioned upstairs is that you have to take charge of your health, which is correct. Because the only person that knows you is you. And I tell that to my patients, same thing. I don't know you, your body, as well as you do. So, but all I'm going to do is give you the tools. I'm going to show you, okay, how do you tell if it is too much? How do you tell if it's too little? And I mean, it's really easy. It's not that hard. It's simple, very, very simple. But if you know how to look for example, let's say that you have too much of estrogen, for example, right? So if you have too much of estrogen, the first thing that happens, you get the breast tenderness.
Okay.
Or you get the breast fullness. Okay,
Okay.
you don't need that. That's not what you
Okay.
need. Yeah? Or if you have, progesterone is really easy. But progesterone, let's say you have too little of it, you will be anxious, right? You will be snapping at your kids, you'll be angry for no reason, you will have mood swings, like you go up and down. So you know, okay, I need more progesterone. But obviously there's a little bit more to that, but in general, those are the guidelines that I actually tell my patients to look for.
Can using the hormones slow the process of your brain aging?
Absolutely, yes. And that's really what I strive for. So, like I said, the brain, okay, so the brain cells are supported by estrogen. Estrogen is a master regulator of energy metabolism in the brain cells. That means that if the estrogen goes away, you don't have enough energy production in the brain cells. So the brain cells can't perform, they can't do their jobs. And then, not only that, they actually die because there is no more energy. I mean, if life is energy, you know, if you have energy, you can live. If you don't have energy, you can't live. Same thing with the brain cells. And plus, it repairs the DNA. So that means you can live, your brain cells can live healthy longer. That's how it works.
What about, so I mentioned earlier that I had been given Premarin at the beginning, and then I thought, okay, I don't like this whole thing. Since we've been doing the podcast, I've learned a lot. I've learned about it passing through your liver. I've learned just everything about it. And I thought, I don't want this anymore. And I spoke with my doctor, and they gave me estradiol patch. I want to know what your thoughts are on this. So, because I've listened to who we speak to that are really experts in the field, and I, really want to know and act accordingly. So I'm curious your feelings on that.
I fully understand your
Yes.
question, and I think it's a very legitimate question. Okay, so this is what I tell my patients. Some patients come to me when they're using the estradiol patch,
Mhm.
right? But, so there's two things to think about. One is that the human body, or the women, have 3 hormones that are estrogens in the body, right?
Okay.
One is called, so it's E1, E2, and E3. And E1 is estrone, estradiol, and estriol, right? So the estradiol is the biggest or the major estrogen hormone, right? And the estriol is the hormone that you get when you're pregnant. So there's a lot of more of estriol gets released in the body when you're pregnant. And when you get older, you have more estrone, which is carcinogenic, which means it's linked to cancer, right? So now what happens in the body, the normal metabolism of the estrogen is like this. So you have estradiol, right, which is a major part of the estrogen hormones. It converts into estrone when you're older. Yeah?
Okay, so that's carcinogenic. Is
That's
what,
right.
Okay.
That's right.
Okay. So it could have been in a pamphlet that I didn't read, in print that's this tiny. And what are your recommendations when it comes to that?
Bridget's like, I'm just going to
Yeah.
ask for myself, what
Yeah.
exactly are you recommending?
Well, what I recommend is mimic nature.
Okay.
Yeah?
Yes.
Because here's the thing, the human body was built over a period of billions of years by trial and error. It's trial and error that's been going on for billions of years to make this body that we have now. So actually Dr. Jonathan Wright, he is a pioneer of bioidentical hormone replacement therapy back in 1970s that he started this. And he says mimic nature. And I really take it to my heart because, again, you can't beat the machine that has been built over a period of trial and error, over a period of billions of years. So the natural ratio, so there is a natural ratio of different estrogens in a woman's body. So the major, like I said, was E2, right?
Mm-hmm.
And then there is E1, tiny bit of E1, which is estrone. We do need estrone,
Okay.
but too much of it is what is linked to the cancer. And then you have estriol, which is also, estriol is very anti-carcinogenic. So
Okay.
it's the opposite, right?
Okay.
It protects you from cancer, whether it's endometrial cancer, ovarian cancer, or breast cancer, right? So the ratios that we use is the opposite. So we never, ever, I've never used estradiol by itself.
Okay.
Because the metabolism in a woman's body of estrogen shifts to more pro-carcinogenic.
Okay.
And this is why older women get cancer. Not
Okay.
younger women. If the younger woman is getting breast cancer, it's from environmental toxicity, right?
Okay.
But the
Okay.
older, so 50 years and older, you have higher risk of getting a breast cancer. So why is that? I mean, the logical question is, why is that? And this is the reason, because of the estradiol converting into estrone.
Okay. Wow. Now, with a combo of progesterone and estradiol, what happens there? Is there still a higher?
Right. So progesterone should, estradiol should, or estrogen should always be balanced with progesterone, right?
Yes.
But yes, it does lower the risk for cancer on the breast cancer or the uterine cancer for sure. But there is still that, so what I do is to fine tune it, right? So what the combination we use, right, is 80% of the estrogen is estriol,
Okay.
yeah?
Okay.
And only 20% is estradiol. Even with just that ratio, we get awesome results.
Okay.
We
You
never
wrote that
have-
down, Colleen, right?
Yes.
80%, 20, 80-20.
So
Yeah.
the estrogen, is that
Estriol.
Estriol.
Well, not is the estriol is the carcinogenic one?
No,
That's the
estrone.
pregnancy.
Estrone is the one that is
Estrone. Okay, that's the one. Okay, so estrone. So you're saying it's 80%. Can you do that combination again?
sorry. So 80% of the formula that we use
Yes.
is estriol, E3.
Estriol,
Is
okay.
E3. That's protective of cancer.
Okay, that's what I
And then E2, which is estradiol, is 20%. We just don't want to take the risk. Why do you want to do that? Why do you want to give yourself 100% estradiol and give yourself increased risk of cancer? So I do every possible way that I can protect the patient. You know, it's not just one thing, it's the many, many things that we have to do. And so that way you want, you know, I just treat patients like I would treat myself. You know what I mean? I mean,
Yes.
that's really the bottom
So
line.
I guess to follow up with that, if a woman comes in and she's experiencing brain loss, like memory loss, and would you just put her on the estrogen common, the 80-20, or would you put them also on the progesterone?
Yes, that's a very good question. So when we do BHRT, which is bioidentical hormone replacement therapy, what we are doing is balancing all the hormones.
Okay.
It's not just one thing. There's no magical one pill that you can take, right? It's a balance. I look at it like this. It's like you have a really old car, you have to maintain it a lot more than if you have a new car. That's really all there is to it. Because body is a biological machine. And if you look at it from that viewpoint, it needs to be maintained. If you want to have a quality of life that you want, you know, that you are demanding. Like, I think it was mentioned by somebody said that in the, you know, upstairs, was that, yeah, it all depends on what you want. You know, what are you demanding? So my treatment for any patient depends on what they want. So if they say, no, I want 100% perfect brain, or I want 100% energy, I mean, actually, in the end, usually it's the patients are happy. I mean, I treat the patients until they are satisfied and they are happy and they feel healthy and vibrant. So until that happens, we keep working on them, and we want to basically balance as many hormones as we can in order for them to get to the point of vitality that they want.
And I guess my next question would be, so you find the balance, and they're getting older, how long can they stay on this?
You can. So this is my question. It's a so common question. People always ask me.
And that's what our listeners, but the listeners want to know.
Yeah.
They're like, okay, I finally found a balance that works for me with HRTs, and now they're hearing things I should go off by the time I'm 60, by the time I'm 65.
Wow. No. So we give you the choice, right? It's like, okay, my car is old, it needs maintenance, when do I have to stop doing the maintenance?
That is such a great analogy, though, but when you
Right?
put it in that perspective, yes.
Yeah, that's what I
Yeah.
say. It's like asking, when do I stop eating?
Good point.
That is
Very good
such a
point.
good point. Yes,
Right?
yes.
Because the way we are doing it is so balanced and so health making that it's not a problem for you. Because not only that, okay, so there is physicians that are experienced, right, and they know how to monitor the hormones. So it's not enough to just put people on hormones and say, forget about it. Oh, I'll see you. You know, sometimes the patients don't even get seen, you know, for years, and they just get refills after refills after refills of the hormones, right? I don't do that because I don't want me to be treated like that, right? I want to make sure, because the body changes as you're getting older. It's not the same body. You know, next year is going to be a different body. So why don't we keep on top of it, right? It's like car breaking down. There could be engine breaking down today, and there could be something else breaking down next, you know, whatever. So this is why I say, okay, we're going to balance the hormones, and then we're going to monitor you. Usually it's very simple. I guess it's simple because I've seen so many of these. It becomes simple in the end. And you just monitor them. Make sure that, I think one of the doctors did mention that she was talking about the metabolites, right? So the estrogen, how do you know the estrone and the estradiol and estriol? The way we find that out is through urine test. So we do the urine test, we find, okay, how much of this person's, so sometimes you have patients that don't have a problem, right? And many times it's like there's no problem in the metabolism. So and those patients don't need anything besides the hormones. Now there is other patients that have more tendency, for whatever reason, genetic, inherited, environmental, whatever it is, they are metabolizing the hormones in that direction where it's going to increase the risk of breast cancer. Right?
Mhm.
Even if I'm using 80% estriol, I'm very careful because I don't want anybody to get cancer or nothing. So I'm looking at that at least once a year, right?
Yes.
And then when there is a problem, right, the good news is this: when there is a problem, you can do something about it without using drugs. So there's many, many compounds out there that will change the metabolism for you. And that will protect you from breast cancer in the future, or even uterine cancer, whatever it is that you are, if you have a higher risk because of your family history. So those are the ones that I really even more monitor very carefully. Like make sure that they do their testing, whether it's a urine test. We also recommend that you do breast thermography.
Yes.
And we also recommend that you get a pelvic ultrasound once a year if you haven't had hysterectomy.
Okay, even if you're not at risk, or if you're at
Yeah,
risk, even if you're not at risk. Okay, yeah.
That's important for a lot of our
Yes.
listeners to know, because not everyone has a hysterectomy as they get older.
Right.
And they're not necessarily doing the pap smears every year anymore.
Right.
So it's important to get a pelvic ultrasound.
Yes.
Yeah, it's
Okay.
non-invasive, right? Doesn't hurt you in any way, shape,
Well,
or
after you've
form.
had children, is
It's just
anything
like who
really
cares?
invasive?
Yeah, yeah. You're like, yeah.
And whatever.
I did. A doctor did give me one, and I was really, really pleased that they were not resistant to prescribe it, because,
Good.
and it was really, I had really no background reason. I had a friend that had passed away from ovarian cancer, and I was just really concerned. And of course, you go to Dr. Google, and then you're like, oh gosh, I'm feeling
Every
all these
symptom,
things,
right.
and everything was fine. But I probably would not have had a pelvic ultrasound unless I had asked for it.
Oh,
So,
yes,
yeah.
yes.
Mhm.
Yeah,
Your
I mean,
best advocate.
yeah,
Mhm.
best, but I have had patients that their doctors refuse to do the ultrasound. I mean, I have many patients like that. So I say, okay, in that case, just do it yourself. It's not very expensive test. It's actually very inexpensive test.
Okay.
And you can get it on your own. You don't need you don't need another doctor, your
To
primary
prescribe.
care to prescribe.
Good to know. Okay, that's
Okay.
really important.
Like go to a
for our listeners.
radiologist or something like that?
No,
or
but
a-
you need a like if you are getting your hormones balanced by
Yes.
a functional medicine doctor or hormone doctor, then you can get them to write you a lab rec.
Okay.
Yeah.
Okay.
A lab order, and then they can go anywhere,
Mhm.
and they can get the pelvic ultrasound. I mean, that's
Okay.
most 90% of my patients do that.
Okay.
Well,
That
that's
is
good.
really good to
That's
share with our
really
listeners.
helpful
Yes.
information for our
Yes,
listeners.
yes.
Thank you so much.
Thank you
We
so
appreciate it.
much.
Dr. Anju Mathur, do you have a website that we can let everybody know about?
Absolutely.
Mhm.
It's called angellongevity.com.
Angel, I have it right here on my notes.
And
Yes.
we'll have it in the show notes, everybody. So
Yes.
thank you so much for joining
Thank you
us.
so
Thank
much.
you. Thank you for giving me this opportunity to speak about what I do every day.
Oh, it's great.
Well,
It's great.
our listeners appreciate information because knowledge is power.
Yes.
And the more information we can give them and options, it's just, we deserve it.
Well, you're very
Absolutely.
welcome. Thank you.